fight among Democrats over health care reform. But their bickering may soon be coming to an end, at least in the Senate, as the Congressional Budget Office gets set to release a new report on the cost of the Senate's reform bill. The CBS News Capitol Hill correspondent Nancy Cordes joins us from Washington with the latest. Good morning, Nancy.
Good morning, Harry. Yes, Democrats are hoping to get those numbers today so they can determine once and for all what's in the bill and what is just too expensive. And they're going to have to make those decisions in the next day or two if they want to get a bill passed by the holidays.
With just days to go before his holiday deadline, the president urged Democrats to set aside their differences and pass a health care reform bill for the American people.
They are waiting for us to act. They are counting on us to show leadership. And I don't intend to let them down.
Now that a public option and a proposal to allow younger Americans to buy into Medicare are both all but dead, independent Senator Joe Lieberman, who was dead set against them, says he is prepared to drop his opposition to the bill.
I'm getting to that position where I can say what I've wanted to say all along, that I'm ready to vote for health care reform.
That means Democrats may be close to securing the 60 votes they need. It comes, however, at the expense of some top liberal priorities.
That's the system we live in, where you need 60 votes instead of a majority. That's very disappointing, but we're going to do the best we can and keep fighting for a better bill.
But last night, there was another setback for liberals as an amendment that would allow Americans to buy drugs from a handful of other countries was defeated.
The pharmaceutical industry flexes its muscles and defeats an attempt for fair prices, fair prescription drug prices for the American people, so that we can keep paying the highest prices in the world.
Now, there are many liberals in the House of Representatives who are furious that Senate Democrats caved, in their view, to moderates who didn't want a public option. The House already has a public option in its bill, and they say they are not going to go down without a fight. Harry?
Nancy Cordes in Washington this morning. Thanks. Joining us now is Democratic Congressman Anthony Weiner of New York. Congressman, good morning.
Good morning.
I read the press release that you sent out yesterday, highly critical of the Senate version of health care reform. And in it, among other things, you say, we need the president to stand up for the values our party shares. We must stop letting the tail wag the dog of this debate. From your perspective, what's most wrong with this Senate version of health care reform?
Well, we've had three things emerge in the last couple of weeks, none of which are good. The first is that the most obvious is that the public option has been jettisoned. That is the part that gives more choice, gives competition to hold down prices. We've also seen language inserted at the end of this process that dramatically reduces a woman's right to an abortion under the health care insurance that she herself would purchase with her own money. That's problematic. And also the health insurance plans being taxed by the Senate to pay for this program is opposite of the incentives we want. We want people being encouraged to give insurance. Taxing them highly the way the Senate would do creates a real problem. Now, all that being said, you know, we can't let the perfect be the enemy of the good, but we are reaching a tipping point, as some people have said.
All right. Well, the original idea about all of this, wasn't this to expand coverage and to bring relief in terms of burden of cost? Does this bill do any of that?
Well, it certainly does a lot of things. Look, it does provide health insurance coverage for 30 million Americans who don't have it. It does that. It helps protect those of us who have insurance from being abused by our insurance companies, drop for pre-existing conditions, putting caps on the things that we would want. But there's no doubt that there is concern about the fact that we don't have as much cost containment as we had wanted.
Howard Dean, a physician, former chair of the Democratic Party, said yesterday it is time to kill the Senate bill and to start over again. Do you agree with that?
Well, I agree that when we go to conference, we should move away from some of these things the Senate has done and move back to where the House is. Look, we need to contain costs. You do that with a public option. The Senate says we want to contain costs, but we don't want the public option. That's why their bill is more expensive than ours. That's why you have a conference committee at the end of the day where we reconcile the House and Senate. I'm going to fight for the Senate, for the House position that included a public option and some of the protections. But, you know, Howard Dean represents a lot of voices in this country now who now see that what we've done is created, you know, the expression is a camel is a horse produced by committee. Well, when it's in the Senate committee, it's even worse.
Even worse. Congressman Anthony Weiner, thank you for your time this morning.
Thank you, sir.